Hello, good afternoon. I'm Dr. Toombs Withers, family physician at Essence of Health Wellness Clinic. Thanks for joining me today. So today I am actually outdoors. One of the things I love to do is to be outdoors, especially in the summer months when it's nice and warm outside. So I am coming at you live today from the great outdoors. But today's discussion is going to be about hepatitis as well as coronavirus and how the actions we have with coronavirus can actually play a part in hepatitis too. So we will dive into that today. So the coronavirus pandemic has continued to remind those of us in healthcare to be mindful of our high-risk groups, help others prevent the development of a high-risk condition, and to keep those high-risk individuals informed and safe. According to healthcare.gov, World Hepatitis Day is recognized annually on July 28th as a day to raise awareness about viral hepatitis, which affects millions of people all around the world. And as we discussed in a previous video, hepatitis is one of those chronic diseases that does increases one's risk of developing severe complications from coronavirus. So today, let's chat about hepatitis. We'll discuss 3 questions. What is hepatitis? How does one get hepatitis? How can someone treat hepatitis or prevent themselves from getting hepatitis? So, tackling our first question, what is hepatitis? So, hepatitis is an inflammatory disorder of the liver. It is often caused by a virus, viral hepatitis, A, B, or C. But it can also be onset by an autoimmune disorder, medications, and substance abuse. Today we will mostly be discussing viral hepatitis. So how do you get hepatitis? So it's important to know how this particular disease is contracted in order to best know how to prevent it. For ease of discussion, I'm going to discuss hepatitis A, B, and C as separate entities. So hepatitis A is most commonly transmitted through what is called fecal-oral route, meaning someone has ingested this virus orally from a contaminated source. This is usually from person-to-person contact with an infected person, sexual contact with an infected person, or as we've seen in many developing countries, ingestion of contaminated food or water. Hepatitis A does affect children and adults. Next, hepatitis B is most commonly transmitted through blood, semen, and other bodily fluids, with primary routes of transmission including birth to an infected mother, sexual contact with an infected person, sharing contaminated needles, syringes, or other injection materials. Hepatitis B does affect children and adults, and it is important to know that most children under the age of 5 may not have any visible symptoms. Then hepatitis C is most commonly transmitted from exposure to blood, primarily through sharing contaminated needles, syringes, or other injection materials. And sometimes, but less commonly, through birth to an infected mother, sexual contact with an infected person, or from a tattoo at a place not practicing safe hygiene practices with their instruments. So let's dive into our next question of how can someone prevent themselves from getting hepatitis or treat hepatitis once infected? Prevention and treatment of hepatitis is very important because untreated hepatitis can lead to the development of chronic irreversible liver disease, liver cirrhosis, and liver cancer. So when we take a look at prevention, one of the main ways to prevent hepatitis is through vaccination. Vaccinations are safe and are available to help prevent hepatitis A and hepatitis B. However, there is no vaccine for hepatitis C. Hepatitis A and B vaccinations are available for children and adults. The best preventative measure for hepatitis C is testing, so that you may know if you are infected and could be potentially spreading this virus. The United States Preventative Services Task Force and the Centers for Disease Control and Prevention now recommend hepatitis C tests for all adults ages 18 and up at least once in their lifetime, with periodic routine screening for individuals at higher risk. Other ways to prevent hepatitis include safe sex practices, using barrier contraceptives, avoiding the sharing of injection materials like needles and syringes, avoiding consuming foods and drinks in areas with potential water contamination. And in terms of treatment, it's important to remember that hepatitis is a virus. So antibiotics, which treat bacterial infections, will not necessarily cure you from hepatitis because it's a virus. However, hepatitis A and hepatitis B can often be treated by your own immune system fighting off these infections. There are no specific medications available to treat acute infections with hepatitis A or hepatitis B. However, chronic infections of hepatitis B and infections with hepatitis C can have antiviral medications. Now, COVID-19 has taught us that it can also cause some damage to the liver, placing those individuals with chronic liver diseases like hepatitis at risk of severe illness. So continue to be mindful of those safe practices we have discussed to prevent the spread of coronavirus. Wear a mask, covering your nose and your mouth when you're out in public. Stay home if you're ill or if you have been around someone COVID-19 positive. Keep a safe social distance of at least 6 feet away from others. Wash your hands frequently with soap and water for 20 seconds or use an alcohol-based hand sanitizer with at least 60% alcohol content. We can all help each other in the prevention and potential spread of this deadly disease. The essence of health is in you. Thank you for joining me. Remember that you can learn more about Essence of Health at www.essenceofhealthwellnessclinic.com. You can also find me on Instagram at Essence of Health Wellness Clinic, and you can see more videos like this one on my YouTube channel at Essence of Health Wellness Clinic. And I can be found on Twitter at EOHWC_DPC. Remember, Essence of Health is celebrating its 1-year anniversary. I invite you all to join me next Friday, July 31st, for a special town hall about Essence of Health Wellness Clinic and about direct primary care, and so that you can hear from some patients who are a part of Essence of Health and learn about their success and what they like about the clinic and about this model of care. Thank you for joining me. Have a good day.